Hi everybody, Dr. Ramey here. This is going to be what I hope is a short video on herd immunity, but really it's going to focus more on calculating um, the herd immunity threshold and the basic reproductive number. But in order to have that conversation or to go over how to calculate the herd immunity threshold, you have to understand a little bit about herd immunity and how herd immunity is achieved. So, herd immunity is indirect protection from an infectious disease when a sufficient portion of a population is immune. So, this is typically through vaccination and also immunity from prior infection. This is sometimes called community or population immunity. And immune individuals act as a barrier, as barriers. So they prevent transmission and they break chains of transmission, and they reduce the chance that an infected person encounters a susceptible one. So this is really important, in particular, to protect vulnerable individuals. So these are individuals who cannot be vaccinated. Maybe they have a weak immune system, or they're very, very young, or they're very old, right? So this includes infants and newborns, anyone who's immunocompromised, such as HIV patients, cancer patients, the elderly, pregnant women, and individuals with severe allergies to vaccines. So the herd immunity reduces this overall burden and limits outbreaks and associated complications, and importantly, associated deaths. So vaccinations really are the key to herd immunity. It's very difficult to achieve herd immunity without vaccination. Difficult, if not impossible, and it would, if possible, it would come at a great cost in terms of healthcare associated costs and deaths. So vaccines are a way to achieve herd immunity without those associated healthcare costs and deaths. So vaccines, in general, vaccines work by introducing a weakened or inactive part of a pathogen. And this triggers an immune system response and results in long-lived immunity for that particular pathogen. And this does so without causing someone who receives a vaccine from getting sick. So they don't get ill. They get the benefits of having gotten an illness, a disease, an infectious disease, without actually having to have gone through that infection or disease, right? So vaccination is the safest and most ethical way to achieve herd immunity, right? Again, avoiding those high costs of natural infections associated with illness and death. So if we want to know, well, what percentage of the population needs to have immunity in order to prevent the spread, right? We have to start with something called the basic reproductive number, or R naught. So R sub 0 is referred to as R naught. And that's the average number of secondary infections caused by one infected individual. And this is in a population that's fully susceptible, right? So this might be, for example, this would have been true early in the COVID-19 pandemic when when no one had immunity, and there was no vaccine yet, right? So that would be an example of when this would be the case, right? When everyone in the population is fully susceptible to a particular pathogen. And when the R naught value is greater than 1, an epidemic is more likely, because that means that an individual that is infected and contagious will give the pathogen, right? So will essentially give the disease to one or more other individuals in the population. So the disease will spread in the population. So if the R naught value is 2, then that means that on average, every person with a particular infectious disease will give that disease to 2 other people, right? On the other hand, if R naught value is less than 1, that means the disease is likely to decline because there's not a perpetuation or spreading of the disease in the population. And there's a variety of factors that influence what R naught is, how long someone is contagious, how long the disease lasts, how transmissible the pathogen is, etc. So there's a lot of things, human behavior. There's a lot of things that can infect R naught. So in essence, R naught is an estimate, not a fixed constant, an estimate of how many people someone that is contagious will essentially pass on the pathogen to, right? Will in essence give the disease to. So some examples of these R naught values. If we look at this table here, for example, the measles. Let me turn this on, my pen. Okay, should have done that first. So measles has an R naught value ranging from 12 to 18. That means at best, someone with the measles will give the measles to 12 people, and at worst to 18 or more people. Right, and so you can see some examples of some extremely contagious pathogens here, like pertussis, polio, diphtheria. Down here's COVID-19. It varies. It's highly variable based on which variant we're talking about. If we're looking at Omicron, it's generally 7 to 10 people that someone would give it to if they had the Omicron variant of the virus that causes COVID-19. So what we want to figure out here is something called the herd immunity threshold, or HIT. It's also called, sometimes referred to as PI, and that's the minimum proportion of a population that needs to be immune to prevent sustained disease spread, or it might be easier to think of it as the proportion that needs to be immune to achieve herd immunity, right? To achieve herd immunity. And again, the herd immunity threshold, or HIT, is also sometimes referred to as PI. And PI stands for the proportion or percentage of a population that needs to have immunity to achieve herd immunity. So essentially, HIT, the herd immunity threshold, and PI are the same thing. And there's two common formulas. They're really the same formula, but in different forms. Two common formulas to calculate this. That is 1 minus 1 over R naught. And then it's 1 minus R naught over R naught. And then, of course, if you want this to be as a percentage, you would multiply those values times 100, right? So in order to calculate PI or HIT, you have to first calculate R naught. And that calculating R naught involves a lot of detective work, right? So epidemiologists need to trace contacts, figure out how many of those contacts of those index cases, how many contacts actually come down with the disease. So once we have that data, I mean, this is an example of why data is so very important when it comes to fighting these diseases and preventing epidemics and pandemics like we saw with COVID-19. So once we've calculated R naught to some level of accuracy, then we can use that value to calculate the herd immunity threshold, and then we can set standards in terms of goals of vaccination rates, right? And so when we know that we've achieved a particular vaccination rate, or a particular proportion of the population has been vaccinated, plus then you can factor in what proportion of the population has a natural immunity from having had the disease, then you can estimate when we have achieved herd immunity. So, some examples of these are like the measles. The herd immunity threshold from the measles is like 92 to 95%. The virus that causes the measles is one of the most contagious viruses on the planet. So it, again, someone with the measles can spread it around to a lot of people. So that this means that so an HIT of 92 to 95% means that we really want to achieve a 95% immunity within a population. Then we can be confident that we've achieved herd immunity and the measles will not spread. And typically that holds true with the measles because of the MMR vaccine protects against measles, mumps, and rubella. And we typically don't see a lot of measles cases when we have 92 to 95% of the population that has been vaccinated, right? But of course, we see these localized outbreaks when these localized communities fall below those herd immunity thresholds. Okay, so now we can work on some practice problems where we have to calculate the basic reproductive number, R0, and the herd immunity threshold, HIT or PI. So here's our scenario. We've got a novel respiratory virus, virus X, in a nursing home. So we presume that everyone in the nursing home is susceptible to this new virus. And our epidemiologists have found that the index cases, there were 3 index cases here, went on to infect a total of 12 other residents. So these are the secondary cases before they were isolated. So remember that R0 is, on average, how many people an infected person will give the pathogen to. So in this case, we can think of it as the total number of cases, or in this case, the total number of secondary cases divided by the number of original cases or index cases, and so these divided by the index cases. And so the total number of secondary cases here was 12, and the index cases were 3. So 12 divided by 3 is 4. So we have an R0 value based on these data alone of 4. Okay, so we've answered question 1 here, what the R0 value is. Now we need to calculate the herd immunity threshold, okay, the HIT. So let's do it using both formulas just so you can see that we'll get the same answer. So the formula for HIT was 1 minus 1 over R0. Okay, so we've got 1 minus 1, and R0 is 4. And so that would be 1 divided by 4 is 0.25. So that would be 0.75. That's a proportion. And if we want that to be a percentage, multiply that times 100, and we get 75%. Now, if we use the other formula to calculate PI, which again, herd immunity threshold and PI are essentially the same thing, but that formula was R0 minus 1 over R0. If we want that to be, again, a percentage, we'd multiply times 100. So here we are, R0 is 4. 4 minus 1 over R0, so over 4 times 100. 4 minus 1 is 3 over 4 times 100. So 3 divided by 4 is 7.75 times 100 is, and we're back to 75%. So again, they're the same formula, different forms of the same formula, and give us the same information. And that is that with these data, we would calculate that we would need to achieve a 75% immunity rate in the in the population or in the nursing home to prevent the spread, right? So if we had a vaccine available, we would need to vaccinate roughly 3/4 of the population to achieve that herd immunity threshold, and that would prevent further spread of the virus. All right, let's try one more problem here. One more practice problem. So if CDC epidemiologists determined that 8 COVID-19 index patients had infected a total of 96 people with the virus, SARS-CoV-2, again, we want to calculate R0 and the herd immunity threshold, right, PI. So we know that R0 is the number of new cases or the secondary cases over the number of index cases. So we had the 96 cases, secondary cases, and then there were these 8 index cases. All right. Okay. So 96 divided by 8 is 12. So we have an R0 of 12. And we'll go with the formula here, which is, I'll write it again, it's R0 minus 1 over I. It's a very simple formula, times 100 for a percentage. And so we have R0 minus 1, so 12 minus 1 is 11 over 12 times 100, and 11 divided by 12 times 100, that's 91.7%. So I'll just put 92%. So, this is in alignment with like Omicron, the Omicron variant. We need to achieve upwards of 90 plus percent. So 92% of the population would need to have immunity in order to achieve herd immunity and prevent the further spread of the virus. Okay, so there are real world challenges when it comes to achieving these herd immunity thresholds. And is a vaccine available? If so, what's the effectiveness of a vaccine? The lower the effectiveness, the higher the vaccination coverage we would need. And immunity doesn't necessarily last forever. We may need booster shots or different versions of the vaccine because of different versions of the virus, as we see with annual flu vaccines that have different formulas, and so far we've seen newer versions of the COVID-19 vaccine as well. And that's because these pathogens, particularly some types of viruses, they mutate and evolve, and they can escape immunity sometimes when they do that and evade immunity. So that requires new versions of the vaccine and more vaccinations. There are, as I mentioned before, pockets of low vaccination rate, and these can cause outbreaks. This is unfortunately all too common with measles, a perfectly preventable disease, but we do see outbreaks. Outbreaks are not uncommon, nevertheless. And of course, we have an increase in vaccine hesitancy, and we have some challenges with access, which are probably going to get worse as well. And not all diseases, these are not applicable to all diseases, and there are different sources for some of these pathogens that present some unique challenges. But a nurse's role, in addition to just helping to administer the vaccines, really is to help educate their patients, right? Explain why vaccines are explain what herd immunity is and why vaccines are essential at achieving herd immunity, and why herd immunity is so important in terms of preventing the spread of these deadly diseases, right? And the nurse's role is increasingly important in terms of helping to address vaccine hesitancy, particularly with parents who have questions about the safety of vaccines or have questions about the vaccine schedules regarding their child or their children, right? So nurses need to advocate and promote for these the importance of these schedules and access to vaccines, and help alleviate some of that vaccine hesitancy, right? So understand that those individual vaccinations contribute to community health, right? So every single person that receives a vaccine is contributing to herd immunity. So the nurse's role is extremely important when it comes to helping address these types of issues. All right, well, I hope that was helpful. I hope now you can confidently calculate R naught values and herd immunity threshold values. And this is another Dr. Ramey tutorial, and Ramey's out.